1. Which instructional approach best supports Fleet Marine Force learners who must apply battlefield medical concepts under stress? A. Rote lecture without scenarios. B. Scenario-based simulation with guided reflection. C. Independent reading with minimal feedback. D. Memorization drills only. 2. When designing a Fleet Marine Force training module on casualty evacuation, which curriculum element ensures alignment with operational readiness? A. Using generic objectives unrelated to field tasks. Embedding learning objectives tied to mission essential tasks. C. Allowing learners to choose random topics. D. Reducing practice time to shorten instruction. 3. What evaluation method most accurately measures competency in FMF emergency triage decision-making? A. Multiple choice tests only. B. Written essays about triage theory. C. Performance-based assessments using realistic scenarios. D. Peer discussions without assessment. 4. When preparing Marines for FMF examinations, which adult learning strategy promotes deeper engagement? A. One-way instructor lecturing. B. Collaborative problem solving on field-based cases. C. Requiring silent study only. Eliminating any group interaction. 5. In FMF communication training, which teaching technique reinforces clarity during high-stress operations? A. Ignoring communication errors to maintain pace. B. Practicing structured brief back and confirmation drills. C. Skipping communication exercises to save time. D. Using ambiguous instructions to test improvisation. 6. When updating FMF curricula, what factor must be prioritized to maintain regulatory compliance? A. Outdated doctrine. B. Current Marine Corps orders and Navy medical guidelines. C. Unverified online resources. D. Informal personal preferences. 7. Which mentoring approach best supports FMF candidates preparing for practical examinations? A. Providing vague guidance and no feedback. B. Offering structured coaching with targeted skill corrections. C. Letting candidates train without supervision. D. Only giving feedback after course completion. 8. To improve retention in an FMF medical trauma module, which adult learning principles should be applied? A. Eliminating hands-on practice. B. Connecting instruction to real operational experiences. C. Presenting content unrelated to Marine Corps tasks. D. Removing all learner interaction. 9. What assessment technique best evaluates how well FMF candidates prioritize care under fire? A. Matching type-written questions. B. Complex field simulation requiring timed decisions. C. True or false worksheets. D. Fill-in-the-blank definitions. 10. During FMF instruction, which communication method strengthens learner understanding of complex clinical tasks? A. Delivering rapid, dense lectures without pauses. B. Using concise steps supported by demonstration and repetition. C. Avoiding visual aids entirely. D. Speaking with inconsistent terminology. Which curriculum element ensures FMF trainees meet mission-critical medical standards? A. Unstructured content. B. Detailed performance standards aligned to FMF qualification criteria. C. Open-ended goals with no assessment link. D. Instructor-chosen topics unrelated to FMF operations. 12. What is the most effective method for evaluating FMF candidates on leadership competencies? A. Timed vocabulary quizzes. B. Scenario-based leadership evaluations under realistic pressures. C. Silent reading assessments. D. Non-contextualized personality surveys. 13. For FMF training on battlefield hygiene, which instructional design principle ensures relevance? A. Using examples from unrelated civilian industries. B. Integrating Marine Corps field sanitation procedures. C. Avoiding operational examples. D. Using generic textbook content only. 14. What instructional feedback approach best supports growth in FMF practical skills? A. Delayed feedback provided weeks later. B. Immediate corrective feedback tied to performance criteria. C. No feedback provided. D. Feedback unrelated to actual performance. 15. When evaluating FMF candidates on communication, which method yields the most accurate measurement? A. Silent written tests. B. Live role-play exercises involving radio communication protocols. C. Reading comprehension quizzes. D. Vocabulary lists. 16. Which mentoring strategy improves mastery of FMF tactical casualty care? A. Assigning irrelevant tasks. B. Modeling best practices and encouraging reflective questioning. C. Allowing trainees to practice without structure. D. Withholding coaching to maintain independence. 17. What's the most effective way to update FMF curriculum in response to revised medical procedures? A. Maintain old content to avoid retraining. B. Integrate updated doctrine and modify assessments accordingly. C. Ignore new procedures until next year. D. Add content without reviewing alignment. 18. For FMF students struggling with navigation tasks, which teaching method is most appropriate? A. Repeating the same lecture without practice. B. Providing map reading drills followed by guided field exercises. C. Giving only a textbook chapter. Letting students figure it out alone. 19. What evaluation tool best measures FMF candidates' ability to perform life-saving interventions under time limits? A. Oral essay presentation. B. High-fidelity simulation with objective scoring. C. Peer voting. D. Instructor opinion without rubric. 20. Which communication skill is essential for FMF operations and must be reinforced during training? A. Speaking without structure. B. Brief, accurate information exchange under stress. C. Excessive detail in every statement. D. Avoiding confirmation statements. What adult learning strategy enhances FMF trainees' recall of medical protocols? Isolated memorization. B. Active practice embedded in combat-relevant scenarios. Irrelevant games. D. Removing all repetition. 22. When assessing FMF land navigation competence, which method is strongest? A. Multiple choice questions. B. Actual terrain-based navigation tests. C. Crossword puzzles. D. True or false worksheets. 23. For FMF mentoring, which approach encourages long-term development? A. Setting unclear expectations. B. Establishing structured development goals and check-ins. C. Avoiding discussion about weaknesses. D. Letting trainees self-evaluate only. 24. Which curriculum method ensures FMF emergency care lessons are operationally aligned? A. Lessons developed without consulting doctrine. B. Mapping objectives to Marine Corps mission requirements. C. Random lesson selection. D. Reducing complexity to avoid practice. 25. What instructional strategy strengthens communication during FMF casualty evacuation drills? A. Ignoring standard terminology. B. Practicing clear, consistent phraseology using repeat back. C. Eliminating communication steps. D. Allowing improvisation with no structure. 26. What evaluation method most effectively measures FMF trainees' understanding of combat stress responses? A. Requiring a spelling test. B. Using scenario-based assessments with behavioral indicators. C. Assigning generic essays. Giving true or false questions only. 27. When teaching FMF trauma assessment, which technique promotes accurate skill development? A. Demonstration followed by supervised hands-on practice. B. Reading descriptions only. C. Eliminating practice to save time. D. Allowing improvisation without standards. 28. For curriculum development, what ensures FMF assessments remain valid? A. Outcomes that don't match instruction. B. Alignment between objectives, instruction, and evaluation. C. Random question selection. D. Instructor preferred topics only. 29. Which mentoring approach best prepares FMF candidates for decision-making under pressure? A. Offering structured, scenario-driven coaching. B. Avoiding high-pressure situations in training. C. Keeping feedback generic. D. Letting trainees practice without direction. 30. What instructional communication strategy improves accuracy in FMF medical reporting? Using inconsistent terminology. B. Teaching standardized reporting formats and enforcing practice. C. Encouraging free-form wording. D. Skipping reporting drills. 31. Which evaluation method best assesses FMF field hygiene proficiency? A. True or false exam. B. Performance inspection of field sanitation setup. C. Reading comprehension test. D. Vocabulary quiz. 32. For adult FMF learners, what instructional method increases motivation? A. Tasks unrelated to their role. B. Training linked to real operational responsibilities. C. Completely theoretical content. D. Instruction without context. 33. Which curriculum revision practice helps maintain FMF exam accuracy? A. Updating content based on doctrine and removing outdated items. B. Keeping all original questions unchanged. C. Changing questions arbitrarily. D. Allowing any instructor to edit without review. 34. When evaluating leadership during FMF patrol scenarios, what tool is most effective? A. Multiple choice tests. B. Observation using a rubric aligned to leadership competencies. C. Word definition tests. D. Peer popularity rankings.